Dear students, welcome back. In the previous session, we have seen the external features of the right atrium. Here, this is the right atrium here. This is again the schematic representation of the heart. Here we are going to see this right atrium again. Here, this right atrium. In the next, we are going to see the internal features of the right atrium. Here you are seeing some dotted lines here. These dotted lines are the line of incision. So to expose the interior surface of the each chambers, so these are the things how to dissect the right atrium. This is the line of incision. So an opening from the upper border, it is a cut is made towards the superior vena cava end, and another incision at the anterior aspect of the right atrium, and then up to the inferior vena cava. So this is the opening, this is the cut of the line of incision of the right atrium, and after incision the flap of this part is open towards the right side. Normally in our textbooks it is placed on the left side to expose the what you call as crista terminalis, to show the crista terminalis. So the opening is made towards the left side. Okay, and here this is the line of incision to expose the right ventricle, and this one is the line of incision for the left ventricle. Okay, now we are going to see the internal features of the right atrium. Here comes the internal features of the right atrium here. So this is the internal structure of the right atrium, and this internal structure is divided mainly into three parts. One is the smooth posterior part or sinus venerum. One is the smooth posterior part. This is the smooth posterior part called as sinus venerum, and this is the rough anterior part. Here cut is made towards the left side. To expose this is the crista terminalis. So because of this crista terminalis only, a sulcus is formed on the right border. That sulcus is called as sulcus terminalis. That thing we have seen in the external features. So this is the anterior part. The anterior part is also called as pectinate part, which also includes the right auricle. And the next part is the septal wall. So this is the septal wall which is present. So the septal wall forms majority of the posterior wall. The septal wall forms majority of the posterior wall. So these are the three divisions of the internal structure of the right atrium. So the first one is the smooth posterior part or sinus venerum. So this posterior part is derived from, developmentally it is derived from the right horn of the sinus venosus. So that sinus venosus we can see in the embryology. Okay, and most of the tributaries we have seen in the external features. The tributaries are the superior vena cava, inferior vena cava, and the coronary sinus, anterior cardiac veins, vena cordis minimi, and the right marginal vein. Out of these six, majority of the openings, majority of the tributaries open into the posterior part. Okay, except the anterior cardiac veins, except cardiac veins. So the superior vena cava opens at the upper end, inferior vena cava opens at the lower end. The opening is guarded by a rudimentary wall called Incision wall. During embryonic life, this valve guides the inferior venal cava blood to the left atrium. So the blood which is received from the inferior vena cava, that blood has to send to the right atrium through the fossa ovalis. That fossa ovalis is present in the septal wall. Okay, fossa ovalis or foramen ovale. Okay, so that is the importance of this wall here. And another opening, that is the coronary sinus. The coronary sinus opens between the opening of the inferior vena cava and right atrioventricular orifice. So this is the right atrioventricular orifice, and this one is the inferior vena cava opening. In between these two openings, this coronary sinus opening is present, and this one is guarded by a valve. So the coronary sinus is also guarded by a valve. Okay, so this coronary sinus of the right atrium is an aperture which receives most of the venous drainage of the heart, and it is returned to the coronary sinus, and it is returned to the circulation by the coronary sinus. That means, so all the deoxygenated blood from the heart is drained by this coronary sinus, which is opened into the right atrium. Okay, so that is the function of the coronary sinus. Here, this coronary sinus is present in the medial part of the sinus venerum. So the sinus venerum is nothing but the posterior part. So that means it is present more medial side to the sinus venerum. So this is at the lower part of the posterior part. This coronary sinus is present. If you see the relation with the inferior vena cava and the tricuspid opening, this coronary sinus to the anteromedial aspect of the coronary sinus, anteromedial aspect of the coronary sinus will have this opening of the inferior vena cava, and at the antero-inferior side of the tricuspid wall, this coronary orifice is present. Okay, this is the relation between the positions of the coronary sinus with that of the inferior vena cava opening and the right atrioventricular opening. Okay, so this is the opening of the coronary sinus. After that, the next openings are the venae caudes minimi. So these venous caudae minimi are numerous small veins present in the walls of the all four chambers. So all four chambers, these veins are present, and this will originate within the myocardium. So these veins originate within the myocardium, that is the cardiac muscle, and pass deeply through the endocardium, and this will pass deeply to the endocardium, and finally it opens into the posterior wall of the right atrium. So these numerous veins also takes the deoxygenated from all parts of all chambers of the heart and runs deeply, and this will open on the posterior wall of the sinus venerum. Okay, so by small openings like small foramen are present. Through small foramens, all these small veins are open into the right atrium. Okay, so and these small orifices or called as venerum minimarium. So this thing is not present in your book. So these openings are called as venerum minimarium. Okay. These vessels are also called as Thebasian veins or vessels. These are called as Thebasian vessels. And another part, that is the intervenous tubercle. Intervenous tubercle is a very small projection. It is visible scarcely on the posterior wall of the right atrium, just below the opening of the superior vena cava. So during the embryonic life, it directs the superior caval blood to the right ventricle. So that is called as intervenous tubercle. So it is seen only during the embryonic life, not after birth. These are the things about the smooth posterior part or sinus venerum. So you have to mention from where the sinus venerum is derived from and what are the openings on the posterior wall of the sinus venerum. These are very, very important things you have to mention. Next, coming to the next part, that is the rough anterior part or pectinate part. Rough anterior part or the pectinate part. This is the rough anterior part. So this is also the anterior part. Rough anterior part and the or pectinate part. Developmentally, it is derived from the primitive atrial chamber. So primitive atrial chamber, that means during embryonic life, the atria is present in the heart. From that chamber, this anterior layer is formed. Okay, this anterior part is formed. So this anterior part presents a series of muscular ridges called as musculi pectini. So series of muscular ridges called musculi pectini. So these arise from the crista terminalis. So these arise from the crista terminalis. This is the internal muscular ridge which forms the sulcus terminalis on the external surface. From this cristae terminalis, these musculi pectini are arising, which runs forwards and downwards towards the atrioventricular orifice and giving an appearance of the teeth of a comb. Okay, so in the auricle, so that means this anterior part also includes the auricle, isn't it? So in the auricle, the muscles, so the muscles are interconnected. In the auricle, the muscles are interconnected to form a reticular network. It is present only in the atrium. That reticular network is seen in the auricle only, not in the remaining part of the anterior part of the atrium. So the remaining part of the atrium, it will have a comb-like appearance, whereas in the auricle, the muscle fibers are arranged in the form of a network. So this is about the anterior part or pectinate part of the right atrium. Okay. Now, and the next part of the internal features of the right atrium is the septal wall. So the septal wall, this is the septal wall. I have mentioned that the posterior wall is mainly formed by this interatrial septum. Okay. So developmentally, it is derived from septum primum and septum secundum. This part is derived from septum primum and septum secundum. Okay. So, and this this septal wall possesses or present an opening called as Fossa Ovalis, but it shows a saucer-shaped depression in the lower part of the septal wall. Okay, this depression represents the site of embryonic septum primum. So this septal wall is derived from septum primum and septum secundum. So this fossa ovalis, this fossa represents the septum primum, embryonic septum primum. Okay. So over this, surrounding this fossa, it is having a prominent margin. So this is the fossa. So over this you can see this a prominent margin is present here. So this prominent margin represents the lower free edge of the septum secundum. So this fossa represents the septum primum, embryonic septum primum, whereas this prominent margin represents the septum secundum. So now coming to the margin, this margin is called as Limbus fossa ovalis. The margin is called as Limbus fossa ovalis, and it represents the lower free edge of the septum. So it represents the lower free edge of the septum secundum, this prominent ridge. Okay, so whenever you call this limbus also, this prominent margin is called as limbus or Limbus fossa ovalis or annulus ovalis. Everything is same. Okay, this margin is distinct above and at the sides, of the fossa ovalis, but it is deficient. The margin is not present on the inferior aspect. Okay, and its anterior edge. What is the anterior edge? This part is the anterior edge. This anterior edge is continuous with the left end. So this is called as valve of the inferior vena cava. This anterior edge of the Limbus fossa ovalis continuous with the left end of the valve of the inferior vena cava. Okay, and the remains of the foramen ovale are occasionally present. So here only depression is present, so there is no opening. So during embryonic life, here it is an opening where it directs blood from right atrium to the left atrium. After birth, this opening is closed. Sometimes it may persist. Okay, so this is about the septal wall, and these are all about the internal features of the right atrium. Okay, so the right atrium, the internal surface of the right atrium is broadly classified into three types. One is the smooth posterior part or sinus venerum, and rough anterior part or pectinate part including auricle, and the last one is the septal wall. Okay, so you have to mention from where these parts are derived from, or any peculiar features are present in these three parts you have to mention. Okay, these are all about the right atrium. In the next session we are going to see the internal features of the right ventricle. Thank you.